Hello, my name is Savannah Smith, and today I will be describing a medial epicondylitis injury through the SOAP process. Medial epicondylitis is commonly known as golfer's elbow, and it is described as the inflammation in the tendons and connective tissue at the elbow. This injury is common among golf players, hence why it is called golfer's elbow. To begin, my patient is a middle-aged female reporting pain and tenderness on the inside of her left elbow. She states pain is a 5 out of 10 on a scale of 1 out of 10, and that it increases when doing tasks with her hands. To note, pain and tenderness aggravation increases after doing golfing sessions. I observed my patient had swelling around the medial elbow and did not have any deformities. The patient is TTP over the medial epicondyle in the left wrist. For the active range of motion assessment, my patient was WNL on all planes, with a 3 out of 10 pain with elbow extension and flexon. For the passive range of motion assessment, my client was WNL on all planes with a 3 out of 10 P with elbow extension. The Cosen's test reported that she resisted wrist extension with radial deviation. I assessed my client was suffering from a mild medial epicondylitis or golfer's elbow injury. Some DDs are elbow sprains or elbow strains. To treat this injury, my patient will need to perform the RICE treatment plan. This stands for rest, ice, compression, and elevation. For rest, she will need to halt golfing sessions and begin elbow exercises after the pain stops. She will use ice on the elbow for 20 to 30 minutes 3 to 4 times a day, and then move to 2 times a day. She'll use a wrap or elbow sleeve to support her elbow tendons and elevate the elbow to reduce swelling. My patient will also need to do these stretches, strengthening exercises, and exercises at a moderate level. 3 exercises are the fist and wrist exercise, rest the arm on a flat surface, make a fist, thumb facing out, move the fist down as far as possible, and then up as far as possible. Perform this 10 times. The flipped wrist plus wrist exercise, rest arm on a flat surface, make a fist, thumb facing up, and do the radial and ulnar deviation, move the fist up and down, perform this 10 times. The supination pronation exercise, keep the elbow bent in one spot, have an open palm, and consistently flip the palm over and over as far as possible. Perform this 10 times. Here are some pictures depicting what I stated, and on every slide there is a link to the video so you can watch it yourself. 2 stretches are the palm stretch, put the arm straight out, face the palm to the ground, then lift only the palm up, and this can be done with straight fingers or a fist. Hold the stretch for 30 seconds. Then the object stretch, using a top-heavy object, do the supination pronation exercise. Perform this 10 times. Again, here are pictures and a link to the video. One strengthening exercise is the bicep curl, where you make the arm completely straight, bend at the elbow, and come all the way up. Come down smooth and slow. Perform this 10 times, then increase. To conclude, my patient will need to complete the treatment process for 2 weeks as it is mild, and she will need to complete all the treatment ideas at home for the next 2 weeks. Thank you for watching my discussion video on a medial epicondylis or golfer's elbow injury and the SOAP process.